Hello to all of you wonderful pharmacy owners, pharmacists, technicians, staff members, and industry folk. Dr. Lisa Fost here, and I want to talk to you today about all of the opportunities that independent pharmacies have because of the excitement and attention around Mark Cuban's new adventure, Mark Cuban Cost Plus Drug Company. Now, they've been in the news kind of almost every month for the last several months as they announce new plans for this particular company. It started out with the lowest cost prescriptions, the cash-based model, doing the really transparent pricing, starting with the cost of the prescription. Then they add 15%, they add $3, then they add $5, all the way up to recently, they're going to be starting their own PBM. They've broken ground here in Dallas, which is my local area, on a potential future manufacturing plant where they're going to be making their own drugs. So they've been doing a lot of really disruptive things in this industry, trying to do things different. And of course, they've gotten lots of attention because Mark Cuban's name is attached to it. And of course, the celebrity billionaire is bound to get lots of news coverage. And those of us in the industry know that independent pharmacies have been doing all of these services plus so much more for years, if not decades, long before Mark Cuban ever came in. And I think the biggest lesson that independent pharmacies can learn from this is the power of publicity and the power of marketing and the power of becoming that local celebrity. You, for your pharmacy, do not need to be a national celebrity on national TV and own a professional sports team in order to make a splash. You really just need to control your local market, which is actually fairly easy to do once you kind of set your mind to it that that's what you want to do. And so I wanted to talk to you today a little bit about some strategies that you can use to possibly get some attention for your pharmacy and to leverage the story of Mark Cuban Cost Plus Drug Company and leverage that in order to get you exposure and to talk about all the wonderful things that your pharmacy does. So in my pharmacy that I owned back in California many years ago, one of the things that I did was really nurture relationships with local media people. And what I mean by local media people, it's your traditional newspaper, TV, news folk, but also think about bloggers or online magazines or just influential people in your community. Really, anybody with influence and reach in your community is worth developing a relationship for. And, maybe in another session, we'll kind of talk about all of the ways that you can grow and nurture those relationships. But the best way is really just to communicate with them on a monthly basis. Send them an email, send them a text message, however you most effectively communicate with them, and just let them know what's going on in your pharmacy. Let them know if you're having a blood drive that month, or if you have a special on a certain supplement, or you started carrying a new product. Just let them know about those impactful things and how your community might benefit, because oftentimes they will run into dead space. They'll have an inch in a column that they need to fill, or they'll have a 3-minute window on the evening news that they need to fill. And if you have that relationship with them, you might be the person that they call in order to fill that gap. That is how I got tons of free media coverage in my pharmacy. We were on the news semi-frequently and on the radio and in the newspaper because we just had good relationships with these media people, and they knew we would not say no. We always said yes. If we were given the opportunity to be on, we always said yes, any way how that we could. So if you take that basic concept and let's apply it to the excitement and the media coverage that's happening around Mark Cuban's new adventure. I've also created a little document for you that you can use. So in the link below, wherever you're watching this, if you're watching on YouTube or audio on your favorite podcast, in the description, I'll put a link where you can get a free download for kind of an outline of a letter. Now, this letter can be most likely via email is how you're going to send this to people, but could even be, via Facebook or whatever communication channel you're using. But basically says, hey, I'm a local pharmacy owner. You're a local news coverage person. Let's have a conversation on how, yes, it's really exciting that Mark Cuban, a celebrity, has stepped in to kind of disrupt the pharmacy world. But I've been doing this in my pharmacy and I've even been doing it better. And here's all the awesome things that we do. One of the things that Mark Cuban, claimed to fame is cheap drugs or low cost drugs. And they always like to use the imatinib, which is, thousands of dollars a month, quote unquote retail. And he's selling it for, I think, $40 or $50. Pharmacies can do that all day long. And I know many independents that have. There's many independent pharmacies that have really great, fantastic cash prices that do a cost plus model, and all different kinds of ways that pharmacies benefit patients and help them save money. I think the really important thing to talk about is the downfalls of when patients start segmenting their prescription amongst many pharmacies. If you have patients and if they're worried about their drug cost, chances are they're probably on some chronic medications that they really, really need. And if they start getting 2 or 3 of those from Mark's pharmacy, and they're getting the other 4 or 5 from a regular pharmacy, now those pharmacists don't know anything about drug interactions. They don't know anything about dosing. It starts to fragment the patient care. And so really the independent pharmacy is like the rainbows and daisies of all-in-one stop shop for patients. You can fill those low-cost cash prescriptions. You can also bill the insurance for their other prescriptions. You can also provide those over-the-counter prescriptions or medications. You can do delivery. You can do testing. You can do all sorts of things in your pharmacy that they get from just one place. And now you can properly screen them for optimization of therapy, drug interactions. You can even offer PGX testing or other services that these other pharmacies, certainly Mark's pharmacy, is just not going to offer. And so I think that's really important that you talk about that personalized care for these chronic patients who need medications, that instead of getting their prescriptions from a faceless, non-caring mailbox, they can instead get similar pricing, sometimes even better pricing from an independent, and still receive that personalized care. So I outlined this in a letter for you, and you can use this letter to reach out to all the media people in your town. And if you're like, well, who are those media people? Well, the big news stations in your town, TV, there's probably a major newspaper or 2 in your town. And so go to their websites and start looking up, beat reporters, researchers. Sometimes it's divided up into the area of your town, depending on how big your city is, but just start doing a little bit of snooping, maybe even have your employees do this if you don't have time to do this yourself, and then just generate a quote unquote media email list. And I like to save this email in my email, whatever platform you like using for your email. And I just saved it as a group email list. And so that way it just had everybody on there, and you can send one email and it goes to everybody. If you are doing this for the very first time, you can absolutely send one-on-one emails and maybe have a little bit more personal conversation. But really, I think blasting it out to all of the media people, the letter is kind of generic enough that it would work just fine, because you're really just talking about, yes, Mark's making a big splash, but you know what? We've been doing it better, and we've been serving this community, and we're local too. And we're here to help the community in any way, shape, or form. And then basically you're just asking, how can you help educate the community? So it's never about promoting your pharmacy. I think that's a big difference that I want to point out. Doing these kinds of activities is never about promoting your pharmacy. It is about educating your community on what's best for them and their therapy. And I think we can all agree that getting mail order prescriptions and segmenting your prescriptions across multiple pharmacies is not good for your community. Disastrous things might happen inadvertently because a patient is trying to save some money. We all know that patients need to save money, and I think independent pharmacies are the best place for them to do that, because they can maximize their insurance benefits while also minimizing their out-of-pocket cost. And I think that is the message that you want to tell these news people, because they will certainly want you to pay for advertising. That is one of the things, and you just have to be good at saying no. Sometimes it is worth advertising. I ended up becoming a big advertiser on radio channels, on talk radio channels, not music, and it worked beautifully. But I leveraged those people and I got tons of exposure first by doing these more educational types of content. And so as they're talking about it and it makes news cycles, as you know, something new is going to come up that Mark's going to do, just reach back out and say, hey, I'd love to have a conversation with this, you know, maybe join the morning news or join the talk radio. Talk radio is one of the best things because they need a lot of content to fill up those hours. And so just start nurturing the relationships. This is a really great topic to get started with. And we've kind of tried to do some of the heavy lifting for you by creating kind of an outline of an email. So feel free to download that, make it your own, you know, use your own words, your own vernacular, your own kind of unique style. This is really just a guideline and a template, but I think this is a perfect opportunity for pharmacies to be talking about all of the awesome services that you've been doing, have been doing, even if you just started doing it. Talk about how patients can be better served by their local pharmacies as opposed to a, you know, celebrity's online pharmacy. As good as it may be, it is not as good as your pharmacy. So feel free to click below for that link, that download. If you have any other questions, you need help, reach out to DiversifyRx. My email is info@diversifyrx.com. Check out our website, diversifyrx.com, and happy hunting for these new opportunities.